Hi, Future Sight here with Pierre and Kumar.
My name is Professor Pierre Boulanger. I'm a professor in the Department of Computing Science at the University of Alberta. And my specialty is into virtual reality and medical imaging. And I am also the Cisco Chair in Healthcare.
Hi, my name is Kumar Punita Kumar. I am an assistant professor at the Radiology and Diagnostic Department at the University of Alberta. I'm also the Operational and Computational Director of the Survey Virtual Cardiac Center at the Mason-Krapsky Alberta Heart Institute. My specialty is medical image analysis and visualization.
Pretty awesome credentials there, gentlemen. So we're here to talk about the VR surgical system. Why did you create it? What was the need?
Well, there were a lot of need for taking basically the information that come from very fancy machine like CT and MRI machine, which are fundamentally 3D information images, and using them in order to actually perform two things. One is improve the conversation between a radiologist and a surgeon, but also to actually being able to allow the surgeon to actually perform surgical planning. So today, as they do, they, for example, use printed 3D stereolithography, it's called, like for example this one, and then the surgeon can go in the operating room and plan his surgery using that.
So that's what exists then, Pierre.
That's what exists.
Okay.
The other thing that Kumar does is also visualize it into big screen in 3D. You can describe that.
So one additional thing that we can provide in virtual reality type environment is that we can provide the cardiac animation, which we cannot do otherwise using 3D printed models.
Yeah.
So these virtual reality systems helps different physicians to communicate with each other as well as to plan a surgery.
Yeah.
So basically what you're doing now with VR technology is you're augmenting what exists in imaging technologies and you're bringing it together in real time in 3D.
Yeah.
Okay.
Well,
so
we wanted to do that, but to expand it, to explode it, if you like. Being able to actually visualize it together at different viewpoint, but also have these viewpoints who maybe been in different cities. So we are adding the video conferencing, if you like, virtual video conferencing aspect to the actual observation of data.
So this is real time around globally. You could interact with what's happening in the surgical planning and surgical site and the actual surgery.
Exactly, because there's no guarantee two experts will be in the same city, and then they will basically be able to take a patient data, take the files of the patient, and as well as the images, and then discuss the case inside a virtual meeting room.
So this goes to our next question. So tell us about what value does VR add to the surgeons or the clinicians and their ability to achieve a higher level of technical success and health outcomes. For example, an initiative in Edmonton, and who are you collaborating with in Canada and globally?
So in current clinical system, the images are looked through 2D screens, which doesn't provide the 3D depth information that is available there in the image scans. So in our center at the Mason-Krapsky Heart Institute, we are collaborating with a number of cardiac surgeons, cardiologists and radiologists. Dr. Michelle Noga is actually the medical director of our surgical Survey Virtual Cardiac Center, and she has been the driving force behind all these developments. And so we've established a number of collaboration within the University of Alberta Hospital at the University of Alberta.